Are you tired of dealing with dry eyes, joint pain, and fatigue? Let's break down the treatments that can actually make a difference in Sjogren syndrome. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. I'm here to provide clear, actionable knowledge to help you manage your health. Today we'll focus on Sjogren syndrome, what it is, how it's treated, and what you can do to take control of this condition. Sjogren syndrome is a complex autoimmune condition that causes dryness, fatigue, and even systemic complications. While there's no cure yet, effective treatments can control inflammation, prevent progression, manage symptoms, and improve your quality of life. Let's discuss the options, including the role of immunosuppressants and emerging therapies. What is Sjogren syndrome? Sjogren syndrome is an autoimmune disease where the immune system attacks the glands that produce moisture, leading to dry eyes and mouth. It also affects other parts of the body, such as joints, nerves, and other organs on occasion. There are two types of Sjogrens. Primary Sjogren syndrome, where this occurs on its own. It's its own condition. Then there's secondary Sjogren syndrome, where this occurs alongside other autoimmune diseases like lupus or rheumatoid arthritis. Who is at risk for Sjogren's? Sjogren syndrome primarily affects women in their 40s and 50s, but it can happen to anyone. It's believed to be caused by a combination of genetic, hormonal, and environmental factors. Common symptoms of Sjogren's include dryness. Dry eyes and dry mouth are hallmark symptoms. Systemic issues, such as fatigue, joint pain, and even organ involvement at times can occur. Other symptoms that are common include swollen salivary glands and skin rashes. Less commonly, neuropathy can also occur. So how do we diagnose Sjogren syndrome? A clinical evaluation to begin with, discussing your symptoms with your doctor. Lab testing, checking for antibodies like the SSA and SSB antibodies and inflammation markers. Specialized testing, including measuring tear production and salivary flow. And on occasion, imaging such as ultrasound or MRI to assess gland function and structure. Treatment options for Sjogren syndrome include the following. For symptom relief of dry eyes, artificial tears, prescription drops like cyclosporine or Restasis can be used, and punctal plugs at times. Dry mouth relief can include saliva substitutes, sugar-free gum, or medications like pilocarpine and Evozac to stimulate saliva production. Immunosuppressants are also frequently used in Sjogren's. Sjogren syndrome is an autoimmune condition, meaning your immune system is inappropriately attacking your own body. As such, medications that slow down your immune system can be helpful in managing the inflammation in this condition. Since there are no disease-modifying treatments specifically approved for Sjogren syndrome yet, we often use medications off-label to manage the immune system's overactivity. Namely, using medications that work for other conditions such as rheumatoid arthritis and lupus that have also been shown to help with Sjogren's. Hydroxychloroquine or Plaquenil is commonly used to manage fatigue and joint pain. Methotrexate helps with joint pain as well as systemic inflammation. Azathioprine or Imuran is often used for more severe systemic involvement. Rituxan or rituximab is a biologic therapy that targets B cells which play a role in this disease. We use this treatment in more significant Sjogren's that has failed other immunosuppressant medications. In cases of severe disease, combining these therapies may be necessary to control organ involvement. It's important to know that these immunosuppressant medications are off-label for Sjogren's, meaning they're not specifically approved for this condition. However, they are widely used in clinical practice because they can effectively manage symptoms. There is ongoing research and new study drugs being investigated that target Sjogren's more directly. These are promising developments that may lead to approved treatments in the future. There are also lifestyle changes that you can make that can be helpful as well. Stay hydrated throughout the day. Use a humidifier to combat dryness at home. And avoid excess alcohol and avoid smoking, which can worsen your symptoms as well. Comprehensive care for Sjogren's is key. Effective care for Sjogren's involves a team-based approach, including working with your rheumatologist for systemic involvement, your ophthalmologist for eye care, and your dentist to address dry mouth and dental issues. Routine monitoring is critical to ensure that this condition is controlled and complications are avoided. The future of Sjogren's treatment is bright. With advancements in immunology and biologics, we're seeing promising new therapies emerge. These treatments aim to target the disease at its root cause, potentially offering better outcomes for patients. Thank you for spending time with me today to learn about Sjogren syndrome. At Chicago Arthritis and Regenerative Medicine, we believe in empowering our patients with personalized care and the latest treatments. For more information, visit chicagoarthritis.com or follow us on our social media channels. Stay informed, stay proactive, and live well.